is Sharing Data, Sharing Power, Tools, Intentions, and Collective Data Efforts, the latest installment in a series of learning events and opportunities through the Data Science for Social Impact Initiative at the Washington University in St. Louis. I'm Dan Ferris. I use he, him pronouns. I'm the Associate Director for Training and Education at the Social Policy Institute. So the DSSI initiative is committed to meeting people where they are on their journeys, working in and around equity and community-centered data practice, strategy, and organizational culture. We are using a Zoom meeting today rather than webinar deliberately and intentionally, not because we don't have the license, but because we really do want people to be actively engaging with each other, with our panelists and our speakers, with each other. And so there'll be opportunities for folks to respond to poll questions, to ask questions, to reflect, to respond, all the things. Before going any further, I would absolutely want to acknowledge our speakers and panelists today, Tony Greco, Tammy Laws, Adam Pearson, Paul Sorenson. Also acknowledge the incredible contributions of Jen Rose Fitzgerald, who's the coordinator for the DSSI initiative, without whom today's event would not be possible. Also would offer and extend a special welcome to Sarah Mohammed, who is the new Associate Director of Engagement and Equity with the St. Louis Regional Data Alliance, who folks will be getting to know more of in this role in the very near future. And we're also joined by Shanna Crumley, who's the Director of Impact Data Science at the MasterCard Center for Inclusive Growth. Shanna, and more broadly, MasterCard's support and investment in data science for social impact is both making this event possible, as well as helping to advance the broader field. So thank you for your work and your incredible support. So what is data science for social impact? What are we gathered here all today? DSSI's real objective is to create learning and connection opportunities around data science and social impact, reflective of and specifically geared toward the social sector. Informing our offerings are multiple roundtables that had participation with over 100 organizations, speaker series, and engagement with a wide range of colleagues and organizations doing really diverse work in the field. Notably, this initiative is based at the Social Policy Institute, whose mission is to foster interdisciplinary and cross-sector collaboration to design, test, inform, and impact innovative policy solutions. I'll take the chance to acknowledge a number of SPI and WashU colleagues in attendance today, supporting this work as participants, as speakers, facilitators, and champions of the idea that we are all data people. This work, more broadly, is guided by an advisory committee pictured here, comprised of St. Louis and national leaders in both data and social impact. We're truly grateful for their participation and shared commitment. Together, we advanced a vision and set of values for this initiative to be fully free and accessible to diverse participants and organization types, to build capacity and connection among the social sector, and to center community and equity across offerings. Part of our set of values is centering participant feedback. We truly want to hear from you, and we've incorporated participant feedback into both the programming approach as well as the actual logistics of events like what we're offering today. The link is in the chat. Just on the off chance you're not able to stay the full time, we'd still love to hear from you at some point. So feel free to go ahead and open up that link in the background. Hopefully it's not one of the 37,000 tabs open in your browser, if it's anything like my browser. But we really do value the feedback opportunity. Definitely less than 5 minutes of your time. And thank you again in advance for your help. As part of this effort of both collecting feedback, we like to share back and get a sense of who's in the room and how people are entering and centering this work. From today's registrants, we were really thrilled by the response here, clearly driven by the great lineup of speakers and the topic. We've got a pretty even split of folks who find that data is informing their work, but might not be their primary focus of their role, with people who working with data is their primary focus. I'm always thrilled to see typically somewhere around 5 to 10% of folks who identify as having little or no interaction with data, but they were so interested and excited to learn about it that soon they'll be checking themselves off as one of those 2 other lines to be sure. Significant majority of folks working in or with nonprofit and government, and then a pretty even split of folks who are here in the St. Louis region, as well as working outside of St. Louis. So we're really interested in continuing to build on those great overlaps between the work and the opportunities here in St. Louis, and also learning from our geographic partners and neighbors, around the country and world. A couple of last humble plugs, and then we will get to what you're here for today. So first and foremost, next month is the next iteration of this series. It's a process, not a product, building equitable data infrastructure. Some incredible speakers lined up, some familiar St. Louis faces as well as colleagues from San Diego and the Community Information Exchange. Please don't miss it. Registration is now open for that. And then, of course, we've also really been interested in exploring both these online spaces as well as in-person opportunities for our St. Louis network and community. So the Social Policy Institute is thrilled to be a co-sponsor of Data and Donuts, which is coming up on Friday, June 24th. Pretty self-explanatory in terms of the opportunity and the event. So if you're a fan of data, donuts, and or some combination of the two, please feel free. We'd love to see you there. It would be a great time to make some additional connection and to co-build and co-imagine what shared data infrastructure and data partnership and collaboration can look like here in the St. Louis region. So if this is your first time at a DSSI event, you are so welcome. Thank you for joining us. If you've joined us in the past, you're well familiar with the foundational map of areas that we view as effective. It's critical for effective, efficient, and most importantly, equitable data science for social impact. So this is clearly a rapidly evolving space and an opportunity for the social sector in particular to lead. And we're so glad to be continuing the series today as we move around our topic areas into collaborate. And to talk a little bit more about what in the heck it is that we mean by collaborate, I'll be turning things over to Jen Rose Fitzgerald to keep us moving and to move us into our event. Thanks again to all for being here.
Thanks so much, Dan. Hi, everyone. My name is Jen Rose Fitzgerald. I am the program coordinator for the Data Science for Social Impact Initiative. And as Dan noted, we have 6 focus areas, and each month we're holding an event like this, zeroing in on one of them. So today, that is collaborate. And so this focus area is about collaborating with community data partners and developing transparent and equitable practices for data sharing. So this means things like building effective partnerships. It means communicating across organizations, establishing shared vision and clear roles for data sharing. It means establishing processes for privacy protection and informed consent. And it means asking some harder questions like, how do you build mutual benefit and trust, not only among different organizations, but most importantly with the folks who are the most impacted by your programs or accessing the services you may provide. So our panel today is going to grapple with some of these questions, and we hope you will too. And just a quick overview of how today will go. Next slide. First, we have Paul Sorenson, who is the director of the St. Louis Regional Data Alliance and a key collaborator on the DSSI initiative. And Paul will provide some big picture remarks and kind of set up the conversation on why collaboration is important and what data sharing can look like and accomplish if it is done well, kind of honing in on the example of how this plays out in relation to housing. And then we have, as you can see, several amazing panelists who work in different capacities in the housing space. And they're going to share a little bit about how does this hit the ground in their work and the opportunities and also the real challenges of working together across organizations to improve services. So we're going to ask them a few questions and do a kind of round robin style, and we'll hear from each of them. And then we'll also pose a few questions for you all along the way in the audience. And at the end, we'll open it up for a larger discussion where you will be invited to share some of your experiences and strategies with one another. So that's the run of show. So with that, to get the ball rolling, I'm just going to turn things over to the illustrious Paul Sorenson.
All right. Well, thank you, Jen Rose and Dan, for that intro. Excited to be here with you all today, as well as next month for the build session. And I think one of the things we wanted to quickly state, right? So collaborate and build of the sessions that we're doing as part of Data Science for Social Impact. I think these are arguably the most abstract, especially for those of you who haven't been service providers trying to share and manage data day to day. It's a kind of a tongue twister. But at the same time, we also think they're hard to separate. And so I'm going to talk a little bit about both, focusing on Collaborate today, but then also stay tuned for some more content next week. Collaborate focuses on the process of working together toward a shared goal, whereas Build focuses on the infrastructure that enables that process. And I think you can already see how this gets abstract pretty quickly. So in order to push up against that abstraction, what we wanted to do here was ground the conversation in a story about how these systems impact a person seeking services, really hoping that it helps illustrate why data collaboration matters, and also underscore why our goals to create an equitable and responsive data ecosystem really can't be achieved without that data collaboration. So I want to tell you a story about Debbie. I think first I'll note this is a composite story I stitched together from what I heard from folks looking for services when I personally ran emergency assistance programs at Grace Hill Settlement House, as well as conversations with folks that you'll hear from later on the panel, as well as in collaboration with the St. Louis Regional Response Team and a knowledge of how these other systems show up in our region and how they impact individuals. So Debbie worked the night shift for the last year at a big box warehouse, and she liked the job okay, especially compared to her last fast food gig. But then last month, Debbie caught COVID. It knocked her out for 2 weeks, and not only had her employer recently revoked a COVID paid leave policy, but then they also ended up firing her for an unexcused absence as she was trying to return. And now Debbie had another problem. She was always running tight on her apartment and on rent in her apartment in Dutchtown, and she missed the last payment when she was out sick. Now she knew that there was a city assistance program and she contacted them, but they had a backlog. And Debbie worried that it wouldn't pay both the past month and current month rent. And it really didn't help long-term, given that she didn't have other income coming in. So she did what she could to make a partial rent payment to hopefully keep her home. She sold about half of her food stamps for the month, figuring that she could eat cheap, as well as a chunk of her diabetes test strips, also figuring that she could make do with less as she got back on her feet. So then one morning, after not being able to reach Debbie, her cousin found her passed out in her apartment and called 911. Debbie woke up in the hospital with stabilizing blood sugar, but also a text from her neighbor that the landlord had thrown her stuff onto the curb and put a padlock on her door. Debbie heard it wasn't legal for the landlord to do that, but she also knew that her stuff was out on the curb today, and she didn't know where to go to get help. Fortunately, Debbie was connected to a social worker at the hospital. That social worker helped her contact the United Way Housing Helpline in search of a place to stay. And then the person at the call center directed her to St. Patrick's Center, which did help her find a temporary apartment for a couple of months while Debbie recovered and looked for a new job. So they even helped provide job placement services to Debbie to find something a little bit more stable and a little less nocturnal, as well as connected her to Arch City Defenders to file an illegal walkout complaint. At the end of the day, I think this is, at least a little bit of how we hope the system to work, at least on the back end. And Debbie felt thankful, a little bit unsettled, but still was able to move out of the shelter and into a small apartment with furniture donated by Home Sweet Home, as another local nonprofit. So that's Debbie's story. And I think before we go any further, I have a quick question for folks I'd love for you to respond to in the chat. So throughout Debbie's story that you just heard, what systems or sectors did Debbie encounter throughout that process? What systems or sectors did Debbie encounter as she tried to find housing? Housing, yes. So clearly, housing infrastructure, I think both in terms of shelter access as well as housing stability and eviction. Hospitals, housing, social services, so hospital navigation, legal support, furniture, SNAP and social services, so benefits navigation, a key part of that process. Anything else folks noticed that Debbie encountered? Yeah, legal aid, hopefully legal aid at the end of the day. Yeah, private business. So the idea of, her workforce itself and some of the things that happened there that impacted Debbie's stability. The United Way, and I think, Stacy, to your comment, I would say the United Way and other intermediaries helping folks navigate services. That's great. Thank you for that. And I think what it does is it really echoes on the next slide, some of the systems and sectors that we could identify throughout this process. So yeah, private business, employment workforce protections, benefits access in terms of SNAP, eviction prevention and protection, which did not work in Debbie's case, but definitely should, emergency medical response, and then the sort of service navigation side, hospital social work, call centers and navigation, temporary shelter, supportive services. There's a lot. And I also feel like there are many on here that folks like Debbie could have encountered, but she didn't in this circumstance. So things like mental health services, recovery services, the court's disability services. Yeah, Sarah, thank you for naming that. Social support is really key. If Debbie's cousin wasn't in touch with her, that situation could have gotten a lot worse. And we also want to underscore significantly that Debbie's interactions with such systems are also heavily impacted by her identity, her race, her family status, disability status, gender identity. And we also need to recognize how these intersecting factors are deeply embedded within social structures, another tongue twister, and social systems. So that's setting the stage, right? There were so many sectors that she encountered in this story that is more common than it should be. And I think if you go to the next slide, or this slide is great. The headlines here, right? No single program, organization, or structure can tackle critical social challenges on its own. And even critical individual challenges require the sort of collaboration and stitching together of multiple different sectors and systems. And so working across these systems is essential, but it's also not magic. It requires ongoing focus. It requires a process and structure. It requires data sharing in order to be effective. And ultimately, we call this process of working together collaboration. And so, again, a little bit of an abstract concept, but hopefully now we're grounded a little bit more in why it matters. So how do we think about collaboration and apply it to our own work in the social sector? And I think that this sort of operationalization is really important, although what you'll hear from our panel here in a few minutes is what this looks like as it gets into practice, and a lot of very specific details are added to the process. So as a starting point, we think this model from Tamarack, the collaboration spectrum, is a really good way to think about collaboration, not just as one thing, but as many things, but highlighting especially to the right side of this spectrum, what they call coordinate, collaborate, and integrate, are all essential. And what we'll say is that some may be more or less appropriate than others, given a social need or challenge on the table. So some of these systems require heavy coordination, but not integration, right? Like you need healthcare and shelters to coordinate with each other. But I think a lot of us would sort of bristle at the idea that a hospital would like run a shelter and a medical model. And so I just want to name that these things aren't like, well, you want to get to integration or merger and anything else is less than ideal. There are a lot of ways that collaboration can be effective and equitable depending on the situation or issue on the table. And there's a lot more to dive into from Tamarack about the collaboration spectrum that I'd encourage folks to check out. Another model is collective impact. And I think going to the Brown School and kind of coming of age in this sector about a decade ago, I still feel compelled to put an exclamation mark after collective impact, because that was all we were talking about for a second. even though now I feel like people are more of like collective impact, like where does this really fit? But we feel like it's still an important model to think about how these components of a common agenda, shared measurement, mutually enforcing activities, communications, backbone coordination fit together, even if we should probably poke on it a little bit and focusing on equity outside of more traditional institutional frameworks. And we also wanted to share this 6 conditions of systems change diagram that they also put together with Peter Senge a couple years ago, and sort of highlight again that to get to structural change, so change in policies, practices, resource flows, collaboration is also utterly essential in a process of moving that forward. But data specific stuff relevant for today. On the next slide, we would strongly recommend the recent white paper. I am so sorry that this got wonky in terms of the sharing. Don't worry, we have a takeaway document that I promise is well formatted here. But we would recommend ASIP's Intro to Data Sharing and Integration, as well as their Racial Equity White Paper, really digs into what data sharing and collaboration looks like in practice and how we should frame it in an equity-focused way. Fortunately, as always, only really going to talk about like the first, line or column of this model in core purposes of data sharing. And so one of the things I wanted to highlight here to help you find your place in this room. One is that some data sharing efforts are what we would call analysis focused. So this is about dashboarding, research, other collaborations aimed at producing shared insights that can drive collective action. And on the other side, there are data sharing efforts that are more operations focused. And what we would say here is that they're more focused on sharing client or patient records to support client level service improvements. And one thing is making sure that folks recognize these are not mutually exclusive. And that many efforts do both, including the folks we'll hear from later today at the continuum of care. We'd also say that like oftentimes people enter in through one of these and sort of need to address the other kind of by the nature of what collaboration requires. So folks at universities, for instance, who are trying to engage in a research practice partnership or otherwise, will come in saying, hey, we need data across school districts to focus on analysis into why student mobility is sort of happening and the impact it's having across schools. But inevitably, it ends up making requests of service providers that may require more operational approaches for moving forward. So that operational approach we'll talk about just a little bit more next month in Build, but it is also worth keeping in mind. They're both critical. They often overlap. So bringing all of this together, what does it look like? So in scanning the sort of big picture collaborative stuff and thinking about how it intersected with data, we felt it was worth taking a risk and putting out another sort of kind of simple 5-step, did you address these items guide, at least for today, that synthesized overall collaborative practices like those in Tamarack with a data specific lens. So Jen Rose is going to be sharing, I think she actually just shared in the chat, a takeaway document with you that goes into these buckets in more detail, the core purposes of data sharing in a complete form, as well as a number of other resources, including those named today, that you can take a look at in more detail. What I wanted to do briefly, though, is just sort of talk about a sort of simple model with some key questions that you can keep in your brain when you think of how can data collaboration apply to my own work and to my own sector, as well as help potentially guide some of the conversation moving forward. First is shared vision. So what are we going to do together, right? Like, where are we going? And really making sure that folks are on the same page about both high level goals, like why does this matter? As well as more tangible, let's set shorter term, intermediate goals as we go down this path. The second, which I haven't seen highlighted as much in some of these other models, are shared parameters. So what constrains or enables what we do? I think one of the things that we have learned in doing data collaboration and other collaborative practice at the Regional Data Alliance is that in a data space, like funding requirements, reporting, privacy protection, even the sort of like capacities or lack of capacity of staff or of data systems really have a huge impact on what we're able to do. And so wanting to surface them early, not to underscore like, oh, we can't do that. Got to be careful about that. But really to sort of understand, hey, like this is what our data system can or can't do today. Or, hey, you know, this is protected health information. So we really need to make sure we have, you know, BAAs in place in order to abide by HIPAA. It's something that needs to be named and on the table. Not necessarily, though, a barrier. I just want to make sure that we state that that is very frequently a problem. The next bucket, shared power, right? So how are we going to do it and with whom? I think we all sort of recognize that the purpose of collaboration is working across stakeholders and building a process for engagement beyond the individual, you know, sort of organizational charts and missions of one organization or another. We want to push on shared power a little bit more and say, yes, any effective collaboration needs diverse stakeholders coming together, but equitable collaboration also requires that impacted communities are a part of that table and a part of that decision-making. It's difficult, but it's essential. And I think figuring out, right, how folks who are the subject of so many of these data sharing efforts have a strong voice in how data is shared and for what purpose is utterly essential. So shared power. Then shared data, right? So, you know, the thing that we actually got into the room to talk about. So how will we know we are, you know, achieving whatever goal we set out to do, both in a framework of shared measurement, which I think collective impact highlights pretty well, though you don't want those measures to be reductive, as well as in terms of shared infrastructure. Again, we'll talk about it next month. And then finally, shared action. So like actually sharing data with each other. And what we would recommend is start small with parameters in mind and get into a practice of building trust while sharing data and learning how you're doing it as you go after those long-term goals and long-term vision. So to tie it all together, and please, if you are interested in the data collaboration model and interested in sort of taking and running with any component of this, please check out the link that Genro shared in the chat. I want to quickly return to this list of systems and sectors encountered by Debbie during her housing crisis. So a lot to talk about across the board. And I want to highlight that a lot of these early systems that Debbie encountered are often structurally racist, classist, right? These policies that caused her housing crisis in the first place need a lot of attention. And if we really want to be collaborative and we really want to focus on root causes, we can't only consider the systems in which folks like Debbie show up, like hospital social work and navigation, but like why people like Debbie are more likely to show up in the first place. And I think there's a lot to discuss just in terms of what's highlighted here in red, which we'll be spending most of our day diving into in exploring a formal collaborative ecosystem for housing supports called the Continuum of Care. Before, really quick, and I know I went slightly over time, sorry, Genros. Before we hand off the mic, I wanted to pause real quick and see if folks had any critical questions or ways to expand our focus on why data collaboration matters before we dive into the specifics. Cool. Seeing none, I know there was a lot thrown at you, and I know that I am also eager to hear from the folks doing this day to day. Again, check the link in the chat for more details or for the takeaway of a lot of this content. And I think back to Jen Rose.
Thanks so much, Paul. And if we can forward the slide. So please feel free to add questions in the chat as we go along. Before we hear from our panelists and introduce them, they had some questions for you all. So they want to know who's in the room today. Starting with this poll, which of the following is a central focus of your organization? And this is a check all that apply situation. I think Dan is going to pull the poll up. There we go. And, in the past, we've certainly seen quite a range of folks showing up at these events. So even though we're focusing on housing today, we know that these questions are relevant across many different sectors. And let's see, we have about 70% participation. You all are doing great. 75% participation. All right. I think we are just couple more seconds and then we'll share the results. All right. So it looks like we have a great mix of people. We have a lot of social services, health, economic development, direct action, and of course, housing, and a big percentage of other as well. Apologies that the education option was missing in the poll. It was supposed to be there, so I imagine there's a lot of you in education. So thank you for that. It's good to know who's in the room. And then the second poll that we have, if you want to pull that up. In your current role, how often do you directly interact with clients or people most impacted by your programs and services? And we'll have Dan pull that up. Regularly, sometimes, rarely, never. Getting some good participation again. Thank you very much. We're at about 70%. And I think this will just help ground our presenters thinking about who's in the room. So just almost there. I would say we have a good number of participants. And it looks like we have about 19% who say regularly, 23% sometimes, 34% rarely, and 23% never. So appreciate all of those responses. And that just gives us a quick snapshot of who's in the room. And so now to hear from our panelists, I just want to start and see if you could each take a minute to briefly introduce yourself and the role that you play in this housing space, thinking about data collaboration, just as by way of introduction. And we can start with Tammy.
Good afternoon, everyone. So glad to be here. Thanks for the invite. My name is Tammy Laws, and I am the Comprehensive Flexible Housing Program Director at Doorways, an agency serving folks affected by HIV. And in this context, I also am a leader within the St. Louis City Continuum of Care, member of the St. Louis County Continuum of Care, have been a consultant to multiple housing agencies, and am a member of the St. Louis Area Regional Commission on Homelessness. So all the things related to housing. So glad to be here. Thank you.
And I can jump in now. My name is Adam Pearson. I work at Peter and Paul Community Services. Our mission is to walk with people facing homelessness on their journey to lifelong stability. And so we have several housing and shelter programs in the community. primarily focused in South St. Louis, but we serve the entire St. Louis region with some of our shelter and housing services. I am the Chief Operating Officer, and so as such, my role is to oversee all of our programs and our facilities, as well as the 50 or so staff who come into work every day and perform admirably at this job to help get people home. I work very often with Tammy, who is a guiding light for our organization. We are also members of the Continuum of Care, both in the city and the county. And we work closely with other organizations to help people find housing in the community and support them in the interim. Thank you.
And Tony, are you there?
Yep, I'm here. Thanks for having me, everybody. I just disclaimer, currently have COVID. And so working through it. So I said, my name's Tony, and I am the founder and CEO of Get Help. And also, I think as an intro would say, the correct way to say it these days is I am a person with long-term recovery. What that means for me is that I've been clean and sober for 27 years. I'm also a child of alcoholics and those with mental illness. My parents met in an AA meeting. And as a result of that, I myself, not as a result of them meeting there, but through their addiction and mental illness, I myself was homeless at 15 years old. And came into recovery at 17 years old. So I'm also a person with lived experience. Through all of that, I earned my doctorate in clinical psychology, all with the intention of finding easier ways to connect people to recovery and getting people the help that they need. After that, I discovered that it was just as difficult for a clinical psychologist to find help for someone as it was for a 7-year-old. And that was the origin of me starting Get Help in an attempt to try to make it easier for people such as us, myself, family members, to connect people to services. Particularly people like Debbie, you know, those people that didn't have resources and didn't know where to go, and for those of us who were trying to help them. We originally started in Los Angeles, that's where I'm from, and started working in recovery there in the homeless shelter space, including assisting one of the largest shelters, I think, in the world, with over 1,200 beds at their facility. And through that and our work during COVID and the emergency shelter crisis, the St. Louis COC, Anthony and Tammy and them reached out and asked us if we could do what we were doing in LA in St. Louis. And so we've been here now for a year, just over a year, and I've been working really closely with the COC, a lot of the folks in this room, and really, really grateful for the work that we're doing here. And I now am a partially full-time resident of St. Louis, so I'm all in.
Wonderful. Well, thank you all for sharing a little bit more about yourself. And you know, I think that when we were trying to think about like, how do we make data collaboration tangible, my mind immediately jumped to the fantastic work you all do, really trying to connect the dots across organizations in service of people who are looking for services. And so, you know, given what was just presented about the story of Debbie, and, you know, the second half of that story, I think is sort of what we want to happen, right? Like, it's an interaction with some sort of connected system, found the right place, was connected to supportive services. But what I would love each of you to do is share a little bit more of what was happening behind the scenes, given your work, your participation in coordinated entry in the continuum of care. You know, how does that show up in your day-to-day, given your specific role in the ecosystem? And I think Tammy, maybe we'll hear from you first, and we'll just kind of go around.
Sure. And thank you, Paul. And I'm going to put just a little bit of framework around what a continuum of care is, because we've said that, but it really actually is one of the first collective impact models that we have evidence of in St. Louis. And basically is a coalition of various agencies that are helping our unhoused neighbors become stable and housed and provided with services. And so under that context, it is, with that, well, so for part of the continuum of care, there is data that we are required by our largest funder of housing services, HUD, to maintain. And that's what we call our homeless services information system. And so that is, otherwise known as HMIS. You will hear us probably say the acronym. So I want to name that because we have a tendency on the continuum of care or COC to speak in acronyms. So please feel free in the chat. If we say an acronym, please feel free to ask us what that is, and we will be sure to double back. So within the system of the continuum of care, Debbie's story basically follows multiple agencies within the continuum of care. And in a perfect world, we would have some data to help tell that story, where we could see exactly which providers did which services with Debbie, so that one, we were not duplicating services, because oftentimes we actually do duplicate services because we're not sure who all the providers in Debbie's life are. And it's not, even though we're a continuum of care, we want it to look like a continuum of care. And so in a perfect world, we would all be sharing that data so that I know if Adam's agency is working with Debbie, I know what they're doing. And we would have some level of shared communication about perhaps even a case plan for Debbie moving forward and who all the members of that case plan are. In addition to that, we would be looking at the data and actually being able to figure out if our services have been effective for Debbie. What did Debbie achieve? How long did it take her to achieve that? Did she sit in a system too long before somebody was able to get to her and provide the service? And so being able to look at the data that we're collecting and make data-informed decisions on where there could be gaps in the system, where other agencies may be missing from the system that we can be recruiting, super important to the work. Also, if we're going to tell the story about collective impact, we've got to have data to be able to share that story in a way that people can dissect it. I know Paul asked a question about how many people directly work with data. Well, most of the people who in reality work on the data, collect the data, and input the data necessarily aren't data people, right? In social services, we're often forced to do some of that data collection without the same understanding of what it means, what it tells us, and how we can interpret and share the story using that data. And so in a perfect world, we would all be data informed, whether you're a data person or not. Having education and access to understanding how data works and how it impacts the work that we do across the sectors is super important as well. And then I think, we can't do this work without funding, and funders often require data in order to fund the work. And we've got to be able to show that impact that we're having. It's all well and good for me to show the impact that my specific agency has had on this client, but how cool would it be if we could show the collective impact of a system moving together, working together, would be just incredible, because lots of our funders, as we know, ask us, do we do collective impact in our work? And we want to be able to not only say that, yes, we do, but show the results of that collaboration. With that, I'm going to kick it over to Adam, because I know he's got more to add to this.
Absolutely. Thank you, Tammy. I think, you referenced this collaboration piece, actually, you and Paul. with that being extremely important. And I think at Peter and Paul, I see it as a couple of different levels. The first level that I see this collaborative focus area is internally amongst Peter and Paul's staff. So when I think about Debbie or somebody similar to Debbie, we can't do all of the work she needs as an agency by ourselves, right? There are myriad other systems and nonprofits that may come into place that would help Debbie become more stable in housing. Internally, Debbie might face one of our social workers, one of our substance use counselors, one of our occupational therapists, one of our psychiatric nurses, a group of students who come in from university for their practicum, for example. And so Debbie comes into contact with all of these people. And part of that collaboration is working amongst our teams to decide on what her goals might be and what does she want to do? What does she want to get really good at? And what is her long-term goal as far as housing? And so that's one piece of that puzzle. And we need data and a competent data approach and strategy in order to inform the team's methods and approach. So that's one level. The second level I see, getting to a lot of what Tammy has referred to with the COC, is that Peter and Paul is one cog in a very large wheel. And so we might send Debbie out into the community for housing, but maybe she already has some case management built in with another agency, or she has family that she can connect with in the community, or a social structure that she can connect with that could perhaps help to bolster some of her success in housing. And so it is good for us to develop these data sharing mechanisms and capabilities with other organizations that know her and know her history and know what she's really good at and know about some of the things that she struggles with. And so that's kind of like the second level. And it's that second level piece that we as an agency are really thinking about now, about once somebody comes into our care, we work with them at our permanent supportive housing program or in our emergency shelter. What happens after that? And so as a member of the COC and as users of HMIS, we are concerned about making sure we put in data into the system that can tell a story to whoever works with her next. But are we following up with her, right? Are we making sure that maybe once every few months after she's discharged, we just give her a phone call just to see how she's doing? And we can use that data to then inform the community partners working with her now on what some of her new goals might be if they aren't already aware of those goals. And so I think that collaboration piece is very important, very strong, both internally and externally, as something to aim for when setting a good data strategy for the agency. Tony, what do you think?
I think so much. And thank you both. And even as, you know, it's funny, we've had these conversations and continue to have these conversations. And even as this is happening, I'm getting new insight into why. And just listening to Tammy and Adam talk just now informed what I would have thought would have been my answer to the question if you'd asked me a few minutes ago. And one of the first things I thought, you know, data for me was always, where the heck is a bed available? I don't know what data you were talking about, but I need to know where there's a bed and where I can put my head or put someone's head at night. And entering into, quote, this space with everybody, data has always been a roadblock. You know, quite honestly, whenever that word has come up, it's been a roadblock. There's been ideas of ownership and fear of sharing it. There's an experience of other, thinking that they own the data, you know. And, you know, my mindset as a person who has been on every side of this system, from being a child in the system, a recipient of services, to finding services for family members, has been that, you know, the client owns the data. You know, this is my data. You know, this is my mom's data. why are we even talking about this? What do you mean you own the data? This is ours, and coming into this space and working with these other partners is really, it's been diving deeper into the complexities, and continuing to, as I dive deeper into the complexities and come at it from this perspective with, almost over half the room rarely or never having interaction directly with a client, like we're coming at it from a different perspective. And this different perspective for me has driven, we call the client the sovereign, right? And has driven the sovereign closer and closer to the center of our ecosystem, and it's also grounded me as a founder, as an entrepreneur, as us as Get Help, into really this first principle of deep listening, and listening to the other stakeholders, because they all have different concerns. And what seems to me has revealed itself is that a lot of these concerns, when you tie it back, and Paul did this during the opening presentation, it was wonderful, thank you so much, is a lot of this ties back to funding and how people are going to continue to provide their services. And, I'm a psychologist, right, at heart, and I'm a systems psychologist. And what I've discovered over the last couple of years of doing this work and listening to various stakeholders is that there's a feeling of, if I don't have this information, how is our organization going to survive, right? And there's this fundamental fear, an existential threat at times to survival. And I talk to my team sometimes because we'll see people react to getting rid of their data, and they're reacting as if it's a matter of life and death, because on some level, even as an organization, it might be, right? That is what drives it. And as everybody was sharing, I realized how powerful it's a parallel process to what the client is going through, right? That on some level, we are all reacting and coming to this with life and death stakes at the table, and it may be our actual death, like I'm going to go back to Debbie probably all day, and it may be death of our organization or our job or our own livelihood and survival. And so when it really comes down to it, why collaboration matters because it is a matter of life and death, so thank you for that. It's the most important thing.
Yeah. No, I really appreciate all of your thoughtful responses on that question. And, Tony, I think it's really important to keep in mind. Folks like me who sometimes look at collaboration as like this ideal state. It's like, why are people in their silos, right? But why people are in their silos is, it's their job, and their job is their livelihood. And like a loss of grant funding and a loss of people's jobs is not an insignificant part of the puzzle. It really matters. And I think that there's social insecurity all around it. I think we may need to address at a root cause, but it's also really important to enter these conversations recognizing the human component, not only in the sovereign or service seeker, but also in the service provider, and particularly that frontline staff member or folks who are situated a bit more in a precarious role at their organization. I want to quickly, as follow-up, Kimberly asked this fantastic question that I think also, can draw from some of the considerations that all of you raised about data ethics, right? And how do you design these data sharing systems in the safest way, the most ethical way, the way that puts people the most at the center? What I want to do, though, is also then push on a little bit where some of those ethical considerations may come into conflict, because the person-centered ownership of information may run contrary to data protection legal frameworks, which are also there for a reason. So yeah, I'm curious about your thoughts, and whoever wants to jump in, around ethical considerations about data portability and data sharing in this space?
I don't mind jumping in. It's the center of our everything in this capacity is really that to us, in my opinion, the client, as I said, owns the data. Now that said, I'm also a mental health professional, and I understand that when a client came into my office and I made notes on that client, that there's a certain point where I also have possession, that some of that is my information on the services that I'm providing that client, and my success or track record or my ability to get paid for that or any of that. That's also my information. So there becomes a shared point, right? Where now it's our data. It's not mine, it's not yours, it's ours. And there's certain information within that I may need to share, and then moving on through the ecosystem. If I start billing an insurance company, now they have skin in the game, so I think it's understanding the complexities of all of that. And for me, the most important point, Kimberly, is putting the client at the center of that conversation, right? So that they are empowered, so that they have insight into what's happening, that they have a historical record, if you will, of what's happening, not just when they go into HMIS, not just when they go into one particular place, but through their entire journey, right? And that they're empowered. The last thing I'll say about this is, in other sectors, in the recovery sector, for example, we're putting a huge investment into recovery outcomes and measurements. And one of the things that consistently comes up is that the client themselves, who are involved in creating these outcomes and very rarely ever see the information, So one of the biggest breakdowns, I believe, is in getting accurate outcome information, in getting accurate information after someone leaves a homeless shelter, and we want to know where they went. We want to know whether they got housed, or we want to know what happened to them. What's in it for them to answer those questions when they never see the results, right? And so that's what we're really investing heavily in, is how can we start to show them the results of a lot of this work? How can we include them in that process? So, I think the broad answer is it's a shared thing. And we need to share in the benefits of that and start to appeal more to the age-old question, what's in it for me?
I'll piggyback. Oh, I'm sorry, Paul, did you want to move us on? I was going to say, I'll just piggyback on that to say that one of the things we talk about over and over and over is, what does our release of information document that we have our clients sign look like? And that is often, and we'll talk about barriers coming up, but that's super important to be really clear with all of the clients that we're serving. This is the purpose for this information. This is how it will be used. This is who we will share it with. And in the case of the continuum of care, a lot of our agencies get money directly from the Department of Housing and Urban Development, and we are required by that funder to say, we are going to share this information with the funder. So, depending on what sector you're on, there could be very different approaches for what you're doing with that data. Also, personally, as in my everyday work at Doorways as a protected agency, because we work with highly sensitive medical data, that looks very different for our clients. We say we will never share this information with anybody else. You're giving it to us, but we will never share it with anybody else. So a lot of it really kind of depends on what the agency does, the scope of work involved, and at the end of the day, is highly, dictated by what the client will allow us to share.
No, I think those are such central considerations, and we'll address it again a little bit in the build session. But in order to put the client at the center, right? I mean, and especially in legitimate concerns about data protection and privacy. Yeah, I think how do we design systems that allow consent to be a little bit more like a conversation that is client controlled? Like sometimes I'll share this information with you, sometimes I won't. It depends on the context, and a little bit less like an all or nothing. And we've seen that, you know, like, well, you're going to sign your data away forever, even if it doesn't necessarily benefit you 3 years from now. And I think how do we dive into, to Kimberly's initial question, ethical data design that also necessitates our systems to be more adaptive and more responsive to those client needs. Well, that does lead us into our next sort of bigger question for all of you around barriers. You know, we talked a little bit about how, you know, Debbie's story and idea like what was happening behind the scenes in terms of, you know, connecting from one organization to another, and what did the handoff look like? But I also want you to raise some of the current headaches you have, the barriers, the challenges that you've encountered in being responsive and connected across organizations to the stories and concerns of folks like Debbie.
Great, I can kick us off with that. So a couple of really key things come to mind. One, I think I sort of said this, but not directly. Sometimes collecting the data is a barrier in and of itself for the clients that we're serving, right? So oftentimes the first issue we come up upon is, you know, what does that look like and how we're going to share that and having that conversation. But, you know, one of the things that I think is very difficult for a lot of agencies is that often the funder gets to dictate what data you collect. And rather than saying, okay, organization, what is your mission? What are your outcomes? What data will you collect to show that? We often come about it because a funder asked us to collect something, then we have to figure out how will we collect this data? What questions will we ask? Are they trauma informed? Are we actually like keeping the client in the center and being thoughtful about how we're asking the questions, the manner in which we're collecting the data, and being explicit about how that will be shared across whatever data sharing platforms we have. Another big barrier is that often agencies end up doing multiple data entry, right? It's very time consuming. It's very costly because you have sometimes a need to put information in a database that's like an organizational database, but it might not be the same database that is collecting information for the funder. And it might not be the same database that you might be sharing information with another sector who uses a whole different system to show their outcomes. And so oftentimes that translates into having our staff enter the same information multiple places because there just isn't the kind of platform needed to communicate between these systems. Also data sharing agreements. So if we're entering into 3 different databases, we're often having conversations about, okay, how can we make it so we enter here, but then you can upload that into your system? Well, that takes 2 different agencies, sometimes 2 different sectors, having a conversation about how to share that data in a way that is, you know, keeping the client at the center, protecting information. And so all of those things are considerations. And oftentimes the data that we're collecting and the amount of time it takes to collect the data and the amount of staff time actually limits us in our ability to actually perform the services needed for the client to actually succeed. And so then having conversations about, okay, how do we like continually look at this process to make sure that we're being efficient with our data collection and able to, at the end of the day, still give the outcomes or the evidence of the outcomes, but not put extra burden on the staff and extra trauma on the client who we are asking these questions of. And I will kick it to Adam.
Yeah, as I think about this, Paul, I see your comment in the chat and my eyes started twitching. 100 full-time staff days per year on duplicate data entry alone. And one of the reasons that strikes me as so maybe alarming isn't the right word, but shocking is that I can see that, right? I think a lot of us in this sector are very familiar with exactly what Tammy has alluded to. Different funders require different data points, and different funders might require a different data strategy. And so one agency might have overlapping or cascading data strategies, and the client is at the center of all of that. And we're asking questions and doing surveys and evaluations and all these measurement tools. And we just got to do one more assessment. And now you go to this person for this assessment battery. And so it can be very difficult. I wanted to highlight sort of two different things. There's kind of like a human element of this as far as a barrier. And then there's the development of the strategy. I think one of the barriers as far as the human element is that entering data and gathering data requires a couple of different levels of making sure that you are accurate with what you're reporting, making sure that you're asking the correct questions, making sure that the platform is user-friendly, making sure that there is buy-in amongst the staff who are actually putting in the data or asking the questions. And so one of the things that we run into every now and then is, I can't speak for everybody else here, but Peter and Paul, a lot of the folks who work for Peter and Paul have 2 jobs or 3 jobs. And so it's just kind of the nature of the economy now that some people have multiple part-time jobs. And so when you're wanting to engage people on making data a priority, I think a big question is, well, do we have sufficient buy-in from everybody in the staff, and is leadership sufficiently training people and getting people excited about putting data in and making sure that people understand the value in data when they're stretched so thin, if they have multiple jobs, if they're only working 3 hours per week or a couple of hours per day. And so one of the barriers is, how are we engaging the human side of like the training and the motivation, and creating a vision that the staff can really get excited about, even as this is one part of their professional identity. I think the second piece of that is that, and I kind of alluded to it before, but a lot of the strategy behind collecting data and making sure that we have a sound strategy for putting in that data or supporting systems is a top-down approach. And we're finding that that isn't necessarily very effective. And so if there can be a lateral approach where we can get some feedback from everybody about what value they see with collecting data, what are some of the barriers that they have with putting in data into systems, then that can help inform what our strategy is. For example, you're typing in a daily note and you get to the bottom and you're about to hit enter to put in this daily note and it disappears. And so now you're thinking, well, did this 8-sentence note that I just create, is it gone into the ether somewhere? Does it exist anymore? I'm really frustrated because I can't find it. And so it kind of dissuades me from putting in other information if I know that the data that I'm entering isn't going to be saved into the system. But then you find out that once you hit enter, the new note doesn't populate at the top of the page where you can see it. It populates at the bottom of the page. And so that's kind of one of those entry conversations that we need to have with frontline staff about, all right, walk through the process with us, tell us what you're seeing, walk through the experience with us, and so we can fix all of these speed bumps and barriers, whether it be sort of internal stuff that we got to work out as far as the process, or if we have to go to the custodian of the data platform itself to make a programming fix. And so I think those are some of the barriers that we see that we're starting to work through ourselves. And I could guess that we're probably not alone as an agency in going through some of that. What do you think, Tony?
So many things, Adam. Like I said, the conversation itself is informing my answers coming in and what I would have thought I might have said. I think it's Shaban. I don't know if I'm pronouncing your name right. I'm horrible. I'm sorry. There's a great comment here about thank you so much for about being and what Tammy was talking about re-traumatizing for people seeking services, you know, and again, putting myself in the position of, you know, I remember being in that position of answering so many questions over and over again. And why do I have to do this all the time? And the thing that was resonating as one of the barriers as well, right, is even thinking about Debbie, when Paul was telling this story, and I thought the moment that Debbie entered the system had already failed her, right? And that's the way I'm thinking about it. Like, this is already a failed system, you know, that just even to get to that point. And when we look at these like previous models and these things that Paul was showing us, where is the client in building these systems, right? That's, to me, probably the ultimate barrier, right? And Adam's talking about TAM, we're all talking about it, right? And I believe that will affect change and create change, because that's where we need to go, you know, is that, you know, if we're not talking about how the system is directly in every moment impacting and benefiting the client in some direct, tangible way, answering the question, what's in it for them? We're really good at answering that question, like Tammy was saying, for funding reasons. We have to have this information in order to meet this funding requirement. Now, there's a way to point to how that affects the client, obviously, but that's not what's in it for them in that moment. And so being able to understand that, I think going back to the barrier being understanding this existential threat, this what's in it for me, for every one of the stakeholders, is on some level life and death, right? Even if it's my livelihood, my job, my funding source, my agency, the people who work for me, right? And really understanding that. And Adam, you said it, the human side. I think understanding that human side, we're all, many of us here probably very well educated, we're in research, we're in data. Understanding the emotions behind this, understanding that there is an emotional reaction for us when we start talking about it, when we get to that existential threat and that idea, and that what that really does is impact our languaging around how we're communicating, how we're asking for what it is we really need or really want, right? And so language, which is one of the things I was going to speak on as a barrier, really ties back to this thread, going back to Debbie, going back to an existential threat, and understanding that language impacts how we go about creating this system and communicating with one another. That more often than not, like since I came to St. Louis, I'm probably the newest person at the table here in St. Louis, which has given me almost this bird's eye view of witnessing people in the same room saying the same thing, but using different words and language, and by virtue of that, arguing with one another. Not really about the core principle, but because they're just using different words and terminology. And we come up against that. We'll talk to someone about a solution, and perhaps the immediate response is, well, what about HIPAA and privacy? And I've gotten to a point now where I just stop and I go, okay, what are they really asking? Right? What's really underneath that? And sometimes it's like Tammy said, sometimes there's issues with security. It's not about HIPAA. It's not about the law that Congress passed. It's about their life and death security at the facility. All right, so let's talk about that. You know what I mean? Let's not talk about regulations. We're talking about a woman in fear of her life. You know, how do we make sure that she's safe? You know, and really getting into that. And you know, so with all of that being the ultimate barrier, if you will, to creating another system, the thing that came to mind, Paul, as this whole conversation was going, was the quote from Albert Einstein: "We can't solve the problem with the same thinking that created the problem in the first place." Right. And so the system itself is an organism. The system itself is an organism whose primary goal is to defend its own survival. Right. I'm a systems psychologist, right? Understanding that the system itself is trying to preserve itself, you know, and how can we do that? And I love, I'll just wrap by Adam talking about top down. So we immediately go to a top down solution. Funding, you have to do this, or a bottom up, grassroots. Let's make it all about the client and not think about funding. You know, and one of the things that we talk about here is this concept, this idea that is still coming into creation, but like this third order change. It's not an either or conversation, it's a both and conversation, right? That all the stakeholders can be represented, you know, and that we can continue to listen, you know, and I believe that we're not getting into solutions right now, but that barrier ultimately coming down to not hearing, right? Not hearing is a huge barrier I'm seeing just as we're talking.
Yeah, and thank you all so much for those, I think, essential points. And yeah, the hope is that if and when, and we must get better at sharing power with folks who are in life and death circumstances, you know, trying to navigate these really obtuse systems, that we will start to better understand and thus, you know, start to systematically deconstruct the barriers that make it so hard for everybody, although also make it harder and the consequences so much more immense, particularly for folks who are systematically disadvantaged, whatever we want to name that system to be. Jen Rose in the chat did place, you know, we had sourced some barriers before this meeting in conversation with the panel on, you know, what gets in the way of data collaboration. And I would, you know, echoing Tony, you know, particularly with the emphasis on how this ends up making it so difficult for folks to find and access services. And curious in the chat or otherwise, if folks want to share a little bit more about what resonates with you or what you've seen in your own work. Yeah, thank you. Thank you so much to Siobhan as well for sharing your experience in how these systems do and particularly do not respond to the situations of individuals. One thing, you know, I want to point out though, Siobhan, is the comment you made previously about the centralization of systems. I think we also need to be careful about some of what was mentioned in duplicate data entry was through an attempt to create a centralized system, but in a way that did not really seek to connect and tie different organizations in different sectors together, which why, again, you know, we'll talk about interoperability a little bit more next month, but this idea of interoperability, which to us means the ability to highly coordinate regardless of decentralization. And I think decentralization is sometimes okay because people build different systems for different purposes in order to meet people where they're at, is really something that we need to be thinking about more deeply. Well, thanks for folks engaging in the chat around the barriers that they have seen or they face in similar spaces. I think the last round robin question we have for you all is, we talked about the ideal, or at least like, hey, here is what's happening behind a system that does help someone in need of shelter find shelter. We also talked about critical barriers that are being faced by individuals as well as by service providers, particularly frontline service providers in these spaces. But I think to close us out, if each of you, for the panel portion, if each of you could share a little bit more about where we go from here. We're all in positions trying to figure out, like, okay, we have, some resources and some systems that can help us move this forward. We also recognize that we have not been nearly as responsive, power sharing, equitable in relationship to the people we serve. So what happens next? Where do we go from here? How do we pursue a truly equitable and responsive, sense of data collaboration?
Yeah, I can start this one off. So when I think about Peter and Paul, we've been around for 40 years now, approaching 41. We wouldn't have come this far without our staff and the employees. And I could just say, kind of from somebody who works across a number of nonprofits and service organizations in the community, we have some organizations in St. Louis that do some really great work and really remarkable work. And the staff are very excited about what they do and their ability to perhaps affect some change in somebody's life or make the system maybe a little bit better for somebody who is seeking housing. And so I think for us, what we're thinking about is looking at the staff members' roles in all of this and kind of gauging what their interpretation of their roles are in this big picture. And so you are not just a behavioral support technician, you're not just a COO, you're not just a cook, you are not just a psychiatric nurse, you are a partner in these solutions. And a lot of this work couldn't be done without your contributions to these issues. And so if they're partners in the work, then we have to understand that they are partners in the data as well. And so Tony talked a lot about, this culture piece, and I think that's exactly right. And the ability to sit down and listen, I think that's exactly right, where we need to sit down with all of the staff, whether you are doing frontline work or whether you are perhaps an accountant with an organization, and talk through what the value of data is and really listen to what their concerns are and listen to the feedback. And in that way, we can sort of move forward with a collective strategy for how we want to make things easier. I think that within an organization, it can be, it's a doable, proposition. It's going to take some time to work through strategy and develop a strategy if you don't already have one. But in the collective, if we have a number of individuals who are using an HMIS system or a Get Help system or a Scout system that the state uses, if we have a number of people who are able to come to the table and say, hey, look, the work we do is great. We want to make sure that we are putting in data into these systems, but here are some very valid and objective critiques about how this could be better. Let us know how you can address these or help or start a dialogue about how we can fix the process a little bit. So I think it is working and listening with all members of an agency across all teams to see if there's a way we can speak the same language, have the same sort of data culture, and cultivate that sharing a little bit more.
Yeah, I'll just piggyback on what Adam had to say. So, one of the great things about the collective impact model is combined voice. And I think that there's, can't overstress enough our need to educate folks on what it is that we're doing and telling some of those real life stories that will help people who are in decision making positions the ability to sort of see what this data collection looks like on the back end from, like what Tony was saying, me going to a funder and saying, hey, I realize that you want to collect this data, but let me tell you what the impact of that is on the person that we're asking the questions for. And can we find another way to get at the same data, just a different way that's more trauma informed? So I think, collectively we have a responsibility to continue to educate not only why the data is important, but how we collect it is probably of the most importance here in this, especially in the sector that we're working with. I also agree with Adam that, data really has to start in any organization looking at the big picture. What is the mission of the organization? What are your goals? What are you trying to achieve? And kind of working backward from there to say, this is the data as an agency from all aspects of the agency that we agree is going to show us the impact that we're making, and really kind of starting with that is the framework and the foundation for how we think about data and how it's collected, and think about how we're sharing it, not just among each other within the organization, but how we're sharing it with stakeholders, including the people that we serve, and using it to inform overall how we deliver services, goods, anything that we're doing. Because at the end of the day, if we can't do that, then we're collecting the wrong data and we're using it incorrectly. And so, oftentimes I think funders will listen, and other people who are saying, collect this data, I do think that there is a chance that if you come to the conversation on the front end saying, here's what we can do for you, here's what we're already collecting, here's how we think that this will help you understand the story we're trying to tell, oftentimes we can make something different happen. Also, I think this has been said sort of, but we've got to figure out ways to get different databases and data points to talk to each other. It's so hard. And now there's so many changes. Nonprofits all over are being forced to be nimble, because you might have a data provider today and it's decided a whole nother data provider is needed. And so how do you work within that framework? How is everybody nimble enough to pivot when we need to pivot? So yeah, just lots of great ways forward.
Thank you, Tammy. Paul, I just keep thinking about Debbie. I'm thinking about there's a Debbie that's about to enter homelessness right now, as we speak. And I'm also thinking that there's Debbie that makes it through a shelter and figures out that they need help in some kind of way or another. Oftentimes I'm meeting her in a recovery context, and that Debbie is now working at one of these shelters, and able to get a job, and is handed some 80-page paper packet and has to complete that damn packet in order to admit a client for one night, and how frustrated she is because she's getting paid minimum wage and has to do all these forms that she doesn't understand, and manages in the middle of all of that to find time to go back to school and get an education, and eventually gets a job where she has the ability to have some kind of influence over some of these decisions, and then is also stuck in a system wondering how she can affect change, and that she needs information to also empower her to make changes in the ecosystem. right? And I'm just thinking of the impact that Debbie has across this entire continuum of care, you know, in every way, and the potential that she has of making an impact, right? And so if all I do is put Debbie at the center of our solutions, you know, not wait for approvals to collaborate, not wait for permissions to have conversations with other stakeholders, invested partners, and whatever, and dive in as deep as I can, you know, to collaborate, to listen deeply, that I don't know what I don't know, right? And this relentless defense of her, you know, and putting her at the center when we start talking about solutions and collaborations and data and all that. I think it's a perfect way. I don't know if you intended it or not, but now whenever I think of data, I'm going to think of Debbie.
No, I think thank you, all of you, for your incredible insight on this. And I think we did succeed in taking an abstract concept and really trying to anchor it in people. You know, Debbie and her journey, but also the intersections of systems and funding and service providers and technology. It's a web, right? But I do feel like, you know, to your point, Tony, if we keep the person trying to navigate this mess at the center and structurally ensure, not just hypothetically, but structurally ensure that they do show up at the center with a voice in terms of how systems are designed and how they evolve, I think we will approach collaboration in a much more holistic and human way. So thank you all. Thus concludes the panel portion of today, and I am going to hand it back to Jen Rose real quick to tee up a little bit of discussion with the folks who are here about how these dynamics show up in your own work.
Thanks so much, Paul. And thank you, everybody. Thank you to our panelists. I was taking a lot of notes. I hope other people were too. And I'm really interested to hear from others in the space for like what resonated with you, what questions you have or things you may have to share with each other. I want to do a quick plug before we go to that, a quick plug to our survey, because this really helps us focus these events and tailor them in ways that are the most useful. So I'm putting that in the chat. It's really quick. It's multiple choice questions. But one thing that the survey really has helped us to do is like, we would like more of this or less of that. And so one thing that we've really heard is that folks are interested in sharing with each other, having a space, not necessarily a highly structured breakout room. Some people just want to go into the space and listen. Some people really want to come off mute and talk, but just some space for more of that kind of connection and sharing. So that's an example of how we're using the survey to really listen and feedback into how we're approaching these events. And so you have the link there. We hope you'll take just a few minutes and fill that out. We really appreciate your feedback. And we have our approach next is that we have two, I call them breakout rooms, but it's really just so that the group isn't so big. And for some people, again, you can come off mute and camera and engage, or if you just need to sit back and listen, that's fine too. We had really good luck with this last time. You will be whisked into these rooms on your own. You don't have to do anything. And we just want to thank you all for being here, and we look forward to continuing the conversation.